Thank you for staying with us on TVC News. Let's talk health, especially with the monkeypox disease in Nigeria, as a patient suspected to have been infected with the virus has now been discovered by authorities of the University of Benin Teaching Hospital, that's in Edo State. This appears to be the first case of the disease in Edo since the outbreak was reported in the country. Nonetheless, the teaching hospital said samples obtained from the suspected patient has now been taken for test, and the result is being awaited from the designated World Health Organization accredited test center. Let's talk about all this now as we bring in medical doctor Tuyi Mebawondu to help us in dissecting this latest development. Thanks a lot, doctor, for joining us again.
Yeah, thank you, Kevin.
This is the same Edo State that 2 weeks ago they said they had embarked on a rigorous, or they will embark on a rigorous campaign. They had set up a situation room. They also had, released emergency hotlines. But what are your, how would you react now to this news of a case, a confirmed case in Edo?
We shouldn't be surprised, because once you raise the standard of the campaign, you are likely going to see more people who might not want to come out, and the diagnostic this might actually increase, people's suspicions might actually improve, and then they may want to report the situation as soon as possible. But it's still far better for Edo State to step up campaign, because again, what do we really have now to really fight the disease? Knowing fully well that we have a broken health system where there's a shortage, massive shortage of health personnel. Epidemiologists are not there, laboratories are not available, and even the resources in terms of funds to really reduce epidemics are really not there. So you have to go for the cheapest thing that is available to you, and that is massive campaign. And you see, we need to do more of that. We need to do more of that, because again, we might be priding ourselves that, well, you know what, this monkeypox is not that deadly. But tell you what, when it's strain that deadly comes. But it then shows that we have a lot of smoldering epidemics or endemic situations hanging around our communities.
I would even like you to talk about that at length, but then corrections are in order. This is a suspected case in Edo, not been confirmed, and like we said, it's been sent on now to Dakar in Senegal, of course, for confirmation. But then I wanted to also expand on that point you made earlier, where you said, and I read up on that too, saying the disease itself is self-limiting. So at what point, and thankfully there's been no deaths so far, but then at what point is treatment necessary if it's self-limiting?
But again, you have to do what we call supportive treatment. That's what you do in most viral diseases, you know. If the person is having secondary bacterial infection, you give antibiotics. If it's losing fluid, you replace fluid, you put to rest, and you are sure. So that's the supportive treatment, because look at it, there's no medication for monkeypox. There's no vaccine.
No medication even.
No medication, you know, specific for monkeypox. Even the vaccine they're talking about is smallpox vaccine. Smallpox has been eradicated since 1980. Who's keeping the vaccine again, except in research institutions where those things are needed? So we're like, open up. So open, nothing you can do about it. But at our own level, what we need to do is that not just monkeypox, all these epidemics that have tendencies to actually, you know, impact on our ways of living, impact on our economy, impact on our even perception and psychology. We need to be able to raise the standard in terms of vigorous, well-targeted campaign directed to the grassroots. Because again, you look at the clusters. What we say is that people tend to trade in the meat of wild animals, you know, monkeys, antelopes, grass cutters, and all those stuff. Well, you can't stop them from eating those things. You know, it's going to be a really tough campaign. But what you can do is to really design ways of handling those things, a single algorithm of handling those things. And then you need to work with the Ministry of Agriculture and Livestock to be able to tell them exactly how to prepare this thing in such a way that, you know, they don't pick diseases from it. And you can remember those days in Lagos, when even in the abattoirs, it was really messy. Somebody woke up and said, let's clean up the way the meats are getting to the people. We need to also look at this trajectory. So
perhaps make them a national...
Yes, to raise a specific standard.
But then you said there's no treatment. So how do the physicians, you know, the health personnel, you know, take care of people with confirmed cases?
Well, you isolate them. You embrace the universal precaution, universal safety precautions in health. And then, you know, you monitor vital signs. You give, if the person has fever, you give antipyretic, you know, to lower the fever. You give antibiotics if you are seeing sign of secondary bacterial infection. If you are seeing sign of dehydration, you also give, you rehydrate.
Right.
So that is exactly the pattern of, you know, what we need to do. But my major concern is just the fact that supposing this virus mutates and then become more deadly, look at it.
So we don't have a control over that.
Well, that is the issue. That is where we don't have control over that. The mutation of that virus, we don't have control over that.
And that's a possibility.
That is a possibility. It might be an attenuated form of the virus now. The next one we're going to get may not be that form. So what do we do? So now, should we now fold our arms and be looking? We have a broken health system. Look at it. Nigerians are not embracing even basic medical education again because to them it's not profitable. And then we're not seeing the influence of government in trying to drive that medical education, training epidemiologists, training medical doctors, bringing out more nurses, and distributing them accordingly. If you see the attrition rate in various government institutions as far as health workers are concerned, it will be alarming. Nigerians are really prepared to do more of external exams to go and practice in another country, like UK, America, and any other country, even in Dubai, than to stay back home. These are critical issues. We are not setting up what we call the health observatory, human resources for health observatory, to look at the movement, because these are key ingredients you need to drive your health system. Somehow. They are tied together, you know. So, but if you wake up and be looking at some other thing, and you don't now declare emergency on the health system in this nation, we are missing a big thing.
All right, Dr. Tuyi Mebawondu, thank you very much. Of course, it's worthy of note that there are 9 confirmed cases now, 94 suspected cases. We hope the statistics will not increase. Doctor, thank you.
We hope so.
Thank you very much for your time with TVC News.